92.7 WOBM. Good morning, Sean Sue with you as we are joined this morning, Sue, for Flu Shot Monday. Sue.
That's what we're calling it? Flu Shot Monday.
I just thought of that a second ago, so
all right,
yeah, I guess that's what we're going to call it. Immediate Medical is here with us today, our Toms River location. We have Dr. Marianne Yale, and we also have certified medical assistant Tricia is with her here
Hi,
as
guys.
well. So good morning, guys.
Good morning.
Thanks for coming in. You know, Immediate Medical is one of my favorite places in Toms River.
She's a regular.
Why,
I
thank
am
you.
a regular, pretty much. But it's cool that you came in here today.
We're happy to be here, keeping you healthy.
Let's, we
Yeah.
hear about flu season, doctor. I mean, are we in flu season? Is there a defined time for flu season? How does that stand?
There is actually a defined time for flu season. It hasn't begun yet. Although we've seen very sporadic cases of flu, we're not in the midst of flu season. Why it's a great time to get a shot now before we're in the midst of it and surrounded by it on all the surfaces and doorknobs and people coughing.
Yeah.
What exactly is the flu? Can you tell me? I mean, is it when it's your belly and your throat and your nose when you have all of those symptoms?
It can be that. The most prominent symptoms of the flu are fever. And we usually see a high
Really?
fever, 102, 103.
Okay.
Along with body aches, severe fatigue. And these are usually the people who come in saying, it feels like I got hit by a bus. All of a sudden, I'm exhausted. My whole body hurts. My head is foggy. And occasionally they have other symptoms like runny nose or cough or nausea. But the main thing is the fatigue,
body
the
aches.
fever, and the body aches.
But there is a big difference between the common cold and the flu, and that we quite often get those two confused.
Absolutely.
Yeah.
The common cold doesn't present with a fever and certainly doesn't present with body aches.
Gotcha.
Interesting. Okay.
Now, do you think it's a good idea, or do you prescribe, you go along with the theory, we want to get the flu shot now before the season is here? Or you can pretty much,
Absolutely.
can you do it into the season?
Of
or is now
course.
the best time?
You can do it any time,
Yeah.
really. But we really like to get it early because the earlier we get it, the less exposed we are. So right
Yeah.
now there aren't that many people walking around with flu,
Yeah.
but in 6 weeks there may be.
Okay.
Is it an old wives' tale, and I hate to pick on the wives, could be an old husband's tale, that you get the flu from the flu shot?
You can't get the flu from the flu shot.
Because you hear that. Sue, you know you've heard that from people. I'm not getting flu shot, give me the flu.
Tomorrow I'm going to walk in. I have
I
flu
got the flu from the shot because she injected me with flu.
No, but do people get stuffy noses maybe from it?
So this is the thing. There's two different kinds of flu vaccines. There's a live vaccine and there's an inactivated vaccine.
Okay.
We give the inactivated vaccine. From either one, occasionally, and it's pretty rare, like 10% of people can get a fever within the first 24 hours. Mostly that's with the live. And with the live, some people get a runny nose, a little cough, and that's about it.
I'll be curious to see, because Sue, with your immune system as low as it is,
That's true. I'm there every other week, all right? At a meeting.
we'll see what happens in the next 24 hours. What's that?
I'm there all the time.
Oh,
I
okay,
really am.
okay, yeah.
And our insurance is not that good there, by the way. I have to pay a big copay when I go there. But I love it.
Well, thank you for
You know what I
coming.
mean? Our insurance is not good.
That's
Anyway,
another topic for
that's
another show for another company. But Immediate Medical is here to save the day, Sue.
Oh, I love you ladies so much over there.
You didn't give her
It's
the
always
shot.
fun.
Did you give her the shot already? Because
No,
getting a little
not
loopy.
yet.
But
She's
you
getting a
were
little loopy. I'm losing her already
You were
over
talking about the inactive, though. So when you give the inactive flu shot, people don't necessarily feel anything from that?
Nothing at all.
Okay,
The most
great.
common side effect is a little bit of soreness in the arm.
Okay, great.
So this is right up your alley here. It's an
Right up my alley.
It's the inactive.
To get a shot?
It's the inactive
Yes,
flu shot.
yeah, I mean,
inactive.
So important to get your flu
Inactive.
shot. I don't know what that. Show what?
It's a joke. I was making a
Oh,
joke.
I don't
Inactive
even know what that means.
means not to be active, Sue.
Are you ready?
I'm ready.
Is she ready?
I'm ready.
Now, you know what else I told her, doctor, was before yesterday
goodness
we were
gracious.
together, and I said, make sure you wear a short sleeve shirt
it up
so
high
they
enough?
can pull it up high enough.
Oh, it's not.
See, they
Oh,
can't
God.
get to
It's
your
not.
arm.
You should videotape this.
Yeah, just
trying to
having
take
to
off
cut
my
your
shirt.
sleeves off.
Maybe I should just pull my pants down.
Don't do that.
And
I
they
gotta
should do
try-
it
I'm trying
from
to get a
behind.
video.
All right.
Now, Tricia,
But-
you're going to be administering the shot today, correct?
Correct.
You're going to be doing it. Okay, so Tricia's getting ready. I want to get some video of this.
The world's going to see my fantastic angel wing. See that? women have this beautiful angel wing up here on the top part of the arm. Right, doctor?
That's a lovely name for it.
See that?
Much better than bye-bye arms.
Okay, so she's getting her ready now.
You're getting me ready.
Pull my. This isn't easy to do.
I put the alcohol.
So, yep,
Okay.
I have the alcohol on me.
All right. What'd
Here
you
we
say?
go.
You're drinking alcohol?
Vodka.
Give me that shot, doctor.
We use baby needles, okay?
Baby
Really
needles?
Small needles.
Okay. All right. You ready for this? You're going to be videotaped.
Here you go,
Here
Sue.
we go. I'm getting my flu shot. Oh,
There you go.
I feel nothing. That's amazing.
You're numb?
No,
Oh.
I'm not numb.
All right.
That was amazing. Oh, look at that little. What kind of Band-Aid?
Elsa.
It's frozen. What's wrong with you?
Oh, there you
So
go.
nice.
Isn't that
Thank
cool?
you.
That's very
That was
good.
gentle. That was nice. And now I'm going to be flu-free. I like it.
Sure are.
There you go, Sue. Easy to do. Easy to do.
Very
All right.
easy to
Come
do.
on over, ladies.
It's time to get Sean's flu shot.
As you
Do want me
notice,
to
I
videotape
did
you?
wear the short sleeve shirt.
I know. You came
I think
prepared.
Andrea's going to get a little video there.
Yes.
Do that, you know.
You came prepared.
I did.
So, doctor, when you walk in, do you have to get a full-blown physical or anything just to get a flu shot, or can you just say, I want a flu shot and just get it?
Don't
Just get a
grab
flu
that
shot.
microphone there, doctor.
Oh.
Yeah, and you're
So
all
you can just
stocked up
walk
and
in.
ready to. We were talking about this off the air. You guys are ready now. Folks want to come in. Flu shots are available.
We are ready. We have plenty of flu shots for everyone.
Do you give it to kids as well, or should they go to... Yes? All right. I didn't know if there's a certain age.
4. Yep.
4 and
Kids
up.
4 and above.
Okay.
Now, how long has
Perfect.
Tricia been with you now? What is the describe what a certified assistant, medical assistant, actually is?
Well, they are angels.
They
are very helpful in terms of patient care.
Okay.
They bring the patient back. They get a medical history for us. They do their vital signs, their blood pressure, and they make the patient feel comfortable
Cool.
when they first walk in the room.
Cool.
Tricia is the first person you talk to before you actually see the doctor.
Exactly.
And they will ask all your, why are you there? And, how can they help you? And what can we say to the doctor to make your visit a little bit easier? And yeah, they've all been wonderful there, the nurses' assistants.
And you can see her smiling faces. It's just what you want to see when you feel
She's
sick.
cute. Yeah,
She doesn't-
and
doesn't
when I
even-
want
You
to...
don't even get a little sting. She's good.
No, but you said you use thinner needles? That's what she was saying. Yeah, they're thinner needles. You can tell.
I have special ordered pediatric needles, very tiny, tiny
It's
needles
amazing.
for this.
And all the
Because it
medicine
really
can go
does.
in.
Wow,
I
that was
didn't feel a
painless.
thing.
That
Did
was
you?
painless.
Honestly, yeah.
No.
It's very quick and easy.
Good job. Sean, we are going to be healthy.
We are set to go. We are good to go, Sue.
Very important to get your flu shot. And we always say it every year. So when is the last time you can get a flu shot, or does it go all winter?
It goes all winter.
Okay.
It goes all winter. We still
right.
have people coming in even in February for flu shots.
Wow.
Certainly, we prefer to get it now.
Yeah, and get
To
ready.
protect
yeah.
you through the winter, especially through the holiday season when people tend to get run down and they're exhausted and
Mm-hmm.
traveling for Thanksgiving and Christmas. And
Very cool. Now, for folks who don't know, you are located right there in the Kohl Shopping Center, right on Route 37 in
Yes.
Toms River. And what are your hours there, Monday through Friday?
Monday through Friday, we're 8 to 8, and
Mm-hmm.
on the weekends, we're 8 to 5.
Okay. And you can get the flu shots at any of those times?
Any of those times.
You can come at 8 o'clock in the morning, get it done.
Absolutely. Before you go to work.
Before we get done here, if you were going to give us a couple of common sense things to do if we feel like we're getting a little under the weather during the winter, what do we do?
So one of the first things is
time
hand
to
washing.
choose.
You know,
It's a
just
matter of
being really careful about hand washing. When when you're shaking new people's hands, when you're touching knobs and doorknobs, especially in bathrooms and things like that, be really good about washing your hands. And the second thing is, if you feel like you're getting sick, take it easy. Rest. Those are the really
Relax.
important times to take care of yourself, and no one does that. But to go home, have chicken soup. Don't go out that weekend. Go to bed early and take care of yourself, because rest in fluids really does work.
All right, there we go. So thank you so much for coming in, giving us our flu shots. We really, really appreciate it.
Well,
Shout
thank you
out
for
to-
having us.
Shout out to Caitlin, too, there.
Oh, yeah. Thank you. We appreciate that.
that.
Good job, Tricia, too. You did a great job. So thank you very
Thank
much.
you, Tricia.
I guess we were good patients, Sue.
Sure.
You are a great patient.
All right, very good. Well, there you go, Sue. You're flu-free now.
Love
And
it.
Immediate Medical, we want to thank them for coming in today.
Immediate Medical. Hopefully, we'll get you more on the air here, and we'll talk more as the seasons go on. That would be great. You know, as we prepare for the winter months and then spring, all the allergies, we'll get you on again.
We'd love to come and talk about those.
You
things.
got it. Thank you so
Take
much.
care. Have
There
a
you
good
go.
day.
Let's go out to the highway, Sue. And Nancy Remy's in. We got our flu shots, so we're all set, Nancy.
We're ready, Nance.
Yeah,
you missed
I'm
it.
supposed to join you
You were
soon,
supposed to
but
be here for
yeah,
that,
Yeah,
but-
yeah,
all right.
exactly. You know,
You missed it.
I
All
will,
right.
never did I feel so left out. I'll follow up shortly.
Take 2
though.
aspirin. Call me in the morning.
No, I'll be joining you. This report is brought